Facial asymmetries are a big deal in airway orthodontics, and we consider that very much when we're doing teeth movements and expansion. It also creates functional issues because when the jaw alignments and the teeth alignments are not on point, it can create a lot of wear and tear issues, facial neuromuscular tensions. It's something that needs to be addressed. So, what causes a facial asymmetry anyway? It can come down to developmental. When we were kids and we were growing to be a certain size and shape, it's a well established fact that pressures that push out and pressures that pull back, we got lip muscles, cheek muscles. If these muscles are not pushing out, like our tongue is supposed to push up into our palate, and if it pushes a little bit harder on one side than the other side, that can actually cause a cant of our upper jaw. Our lip and cheeks attached to our upper jaws, and there's no doubt that some of us smile and the muscles work a little bit differently on one side than the other side. So, if while the muscles and the jaws and bones of our face are developing, the pressures are a little bit different on one side versus the other, that's certainly going to impact the size, shape, and alignment of the bones and teeth as they develop. Birth trauma. There's no doubt that when kids are born, they're getting pressures placed upon their head. The heads can get squished, and it can certainly affect the size and shape of the face and the cranial structure. Oral habits. You put your fingers in your mouth, you suck on things, pacifiers. That can certainly change the size and shape of the mouth and the palate and the face. If your orthodontist puts wires and brackets on your teeth and they're pulling this way and that way, trust me, they're not only moving your teeth around, but they're putting pressure on the bones of your facial structure. And those pressures are not always symmetric. And that can certainly affect the symmetry in the facial structure. When it comes to facial asymmetries, we need to define actually what is it that is not symmetric. Is it the bone? Is it the upper jawbone? Is it the lower jawbone? It might be that the way the upper jaw and teeth are causes the lower jaw and teeth to come together in a really wonky way just because of the way the teeth and jaws align and fit. Could be a midline discrepancy. Maybe the upper teeth, the very front teeth, should be in the middle of the face. They could be a little bit off to the right. And it could be the teeth that are shifted. And in fact, the jawbone is in the right place, and that correction could be to move the teeth back into the midline. The first step in correcting a facial asymmetry is to actually properly define what the asymmetry is and what caused it, because that's going to be the key to correcting it. We have a lot of different appliances, and there's surgery, and there's orthodontic treatments such as aligners, braces, different things that can correct facial asymmetries. And we need to not only correct the facial asymmetries, but we need to correct the root cause of what caused the facial asymmetries, because sometimes there are still issues at play. And if we correct the facial asymmetries, and for example, maybe the root cause of the facial asymmetry was muscles on one side of the face working a little bit different than the other, or tongue posture, if we get things corrected, the things that cause them to get messed up to begin with, if they're still there, they'll actually cause things to recur. The last thing that I'll say about facial asymmetries is we need to really pay close attention to how we define when the structures are actually symmetric. Sometimes all people will do is they'll draw a straight line between the eyes, and they'll assume that everything should be centered about that line. That is, as long as that line is like level. But what if the straight line between the two eyes is not level? Sometimes what people will do is then they'll start looking at the sides of the lip, and we'll start getting really confused about how to define what is actually symmetric. Really, the best thing to do is take a perfectly parallel line and take a perfectly perpendicular line and consider if the base of the skull, the level of the eyes, and the level of lips are actually square as compared to these lines.